Hi all. Today's topic is on hemostasis, understanding blood clotting. So what is hemostasis? Hemostasis is the physiological process of stopping blood bleeding. So it protects the body from blood loss and restores blood circulation within the blood vessels. So the five components involved in hemostasis are blood vessels, platelets, the coagulation cascade, inhibitors of coagulation, and the fibrinolytic system. So the blood vessels and the platelets are the primary components involved in hemostasis. So the role of blood vessels. Blood vessels plays an important role in hemostasis by constricting to reduce blood flow at the site of injury, exposing collagen that facilitates platelet adhesion, and providing a surface for the coagulation cascade to stabilize a clot. So how it happens? As the endothelium, it's capable of activating the coagulation system, the fibrinolytic system, the inhibitor pathway, and the release of von Willebrand factor. So this von Willebrand factor acts as a bridge between the platelet and the subendothelial collagen. So subendothelial collagen, when exposed, it helps the platelet adhesion to the collagen. And vasoconstriction happens at the site of injury, which reduces blood flow and prevents excessive bleeding. So this is the role of endothelial cells in hemostasis. So whenever there is an injury near the endothelium, the thrombin is generated. So this thrombin can activate the coagulation cascade. At the same time, this thrombin, it binds to the thrombomodulin, and this complex can activate the protein C system, which is the inhibitor pathway, and it inhibits the factor 5 and factor 8. This thrombin generated stimulates the endothelium and it produces plasminogen activators, so which activates the fibrinolytic system and the clot is lysed. So what subendothelial collagen does? So some subendothelial collagen binds to the von Willebrand factor, and this von Willebrand factor act as a bridge between the collagen and the platelets and causes platelet adherence to the collagen and forms the primary hemostatic plug. The role of platelets. The platelets adhere to the subendothelial collagen followed by injury and forms the primary hemostatic plug. So the role of platelet in hemostasis. The platelet adhere to the von Willebrand factor and the collagen following an injury. So this causes the activation of platelets and causes the change in the shape and release action. The serotonin produced from platelets helps in the vasoconstriction also, and the ADP secreted thrombin, thromboxane A2. This causes the platelet aggregation. First is adhesion, then followed by aggregation, and forms a hemostatic plug. So the next is the coagulation pathway or the coagulation cascade. So it consists of three pathways: the intrinsic pathway, the extrinsic pathway, and the common pathway. Intrinsic pathway and extrinsic pathway merges to the common pathway. So there are 13 factors involved in the coagulation cascade. Along with that, precalciferin and high molecular weight kininogen, which helps in the activation of coagulation cascade. So this is the coagulation pathway, which includes the extrinsic pathway, the intrinsic pathway, and the common pathway. The extrinsic pathway, whenever there is a tissue damage, it activates the factor 7 to the activated factor 7. The factor 7 along with the tissue factor, which is factor 3, causes the activation of factor 10 to activated factor 10, and this causes the prothrombin conversion to the thrombin, and this thrombin converts fibrinogen to fibrin, and with the help of fibrin stabilizing factor it converts the fibrin to a stable fibrin clot. And the intrinsic pathway, which consists of factor 11, factor 12, it starts from factor 12, then factor 11, the factor 9, factor 8. So this causes the activation of factor 10, and it continues, and it converts prothrombin to thrombin, then fibrinogen to fibrin, and forms a stable clot. So how to remember this pathway? It's very easy. Extrinsic pathway, intrinsic pathway, and common pathway. The common pathway starts from factor 10. So 10 is our keyword. in extrinsic pathway, you have factor 7 and factor 3, which is the tissue factor. So 3 plus 7 is 10. In intrinsic pathway, the pathway starts from 12, exclude the factor 10, then you have factor 12, factor 11, factor 9, and factor 8. And in common pathway, there is factor 10 followed by factor 5, which helps the conversion of prothrombin to thrombin with calcium ions. And you have prothrombin and fibrinogen. So it is factor 5 into factor 2, which is prothrombin, and factor 1, which is the fibrinogen. So 5 into 2 into 1 is 10. So this is the easy way to remember the entire coagulation cascade. Next is inhibitors of coagulation. So whenever this coagulation cascade is activated, there is another mechanism which consists of inhibitors, which inhibits the coagulation cascade and prevents the extension of the clot. So there are natural inhibitors, mainly include the protein C, protein S, and antithrombin 3. So this is the inhibitor pathway. So the fibrinogen is converted to fibrin with the help of thrombin. This thrombin activates the protein C to a activated protein C. So activated protein C along with protein S inactivates the factor 5. So this process helps to prevent the stoppage of coagulation cascade. So next is the fibrinolytic system. So whenever there is clot happen, there should be a removal of fibrin from the clot to dissolve the clot. So this is a very small pathway which includes plasminogen activators. So these plasminogen activators like urokinase, streptokinase, it converts plasminogen into plasmin. This plasmin is controlled by antiplasmin. So this plasmin converts the fibrin to FDP and D dimers. So this is a fibrinolytic system. And disorders of hemostasis, you have 5 factors: your blood vessels, your platelet, coagulation factors, thrombophilia, and the inhibitor pathway and the fibrinolytic system. So you can have vascular purpuras, which can cause the disorders of hemostasis. Then the platelet, which includes quantitative and qualitative. Quantitative, when there is thrombocytopenia, and qualitative, which includes the receptor, Bernard-Solier syndrome, Glanzmann thrombasthenia, von Willebrand factor disease. So when you have a von Willebrand factor disease, it can cause the reduction of factor 8 also, because von Willebrand factor carries the factor 8 in the circulation. So then you have the coagulation factor deficiencies. So main coagulation factor deficiencies include all, but the prominent ones are factor 8 and factor 9, which is hemophilia A and hemophilia B. And you can have all other coagulation factor deficiencies. Some are rare, but the next is thrombophilia. When you have a factor laden, which is actually a resistance to the factor protein C. Factor 5, it forms a resistance to the protein C. Then protein C deficiency, protein S deficiency, antithrombin 3 deficiency, and in APLA. Usually this happens when there is autoimmune conditions and followed by pregnancy. There is a possibility of body to produce antiphospholipid antibodies like lupus anticoagulant. So this one can cause thrombophilia. And the disorders of fibrinolysis system like antiplasmin deficiency, which can cause a late bleeding after surgeries. Thank you.